Hi everyone, this is Dr. Jason Profetto. This is the MF3 clinical skills preceptor orientation. So, what a time we have had. I apologize for any delays in getting this out. The major problem is that we didn't know exactly what was going to be happening in MF3 as a result of COVID and the recent lockdown and all sorts of different regulations and policies coming through. Now, what we are going to be doing today is a short, I'm going to try and keep it brief and focused, this orientation, because what I really want to do is make sure the clinical skills preceptors, you, people that are listening, are actually up to speed on what needs to happen. It's not that complicated, but I think there's just a few important things that we need to do. So I bring your attention over here. These are the medical foundations. Actually, let me do it. We'll do it over here. So Medical Foundation 3 is, here we are, this is what I was referring to, MFs 1, 2, 3, 4, and Integration Foundation. So the medical school at McMaster has a pre-clerkship and a clerkship. Many of you already know this, I'm sure. Just to make sure that the basics are coming through though, the pre-clerkship is going to be divided into 5 medical foundations, and this is where the bulk of the information is taught. Remember, in each medical foundation, there's 3 core parts. There's going to be the tutorials, there's going to be professional competencies, and then what you will be teaching is clinical skills. Clinical skills is once per week. Medical Foundation 3 is about 3 months long, and I'll show you the schedule in a second, but what's going to be happening is there's going to be weekly sessions. They will be organized and scheduled for you, and each tutorial group is made up of approximately 6 to 7 students, whether that be in Hamilton, Niagara, or Waterloo. And each tutorial group is assigned a tutor who meets with them for their tutorials twice per week, usually on Monday, Thursday, or Tuesday, Friday. And then once per week, the tutorial group will meet with their clinical skills preceptors. The clinical skills preceptors are usually designated in a pair, so there's going to be 2 clinical skills preceptors per group. Clinical skills preceptors are generally residents. So, and that's what we're going to be doing. So this is the new curriculum. So Medical Foundation number 3 is different than it was a couple of years ago. You can see here that Medical Foundation 3 is going to be a mix of GI and nutrition, endocrinology, and reproduction. As it pertains to clinical skills, you're going to see GI, endocrine exams, and obstetrics and gynecological stuff as it pertains to the different exams and histories that we do. I'm going to show you, so this is MedPortal, which everyone should have access to. These are all the MF3 planners that you'll see. These are all the people that if you need to get in touch with anyone, you have. The important downloads is where you're going to find the clinical skills guide. And if you were really interested, like you can look at the MF3 guide and the actual anatomy guide, the leave of absence. There's all sorts of things here, sessional dates and specifics for the actual class. But the clinical skills guide, the 4th edition, the MF3, is a revised guide that this is what we're going to be using when we are teaching clinical skills. So I just want to bring you through it for a couple of things. There's a lot of introductory stuff here for students and preceptors that are coming in. You can give it a read if you want at one point. The AFMC, National Clinical Skills Curricular document. This is a national document, Canada-wide, that all the chairs of the clinical skills teams have worked on over the last 10 to 20 years. And if you actually go to this, it'll show you all the different clinical skills across all the different disciplines that are expected and what's expected in pre-clerkship and what's expected in clerkship. But just so you know that a lot of what we do in terms of what we teach and when we teach it is based on this clinical skills document. There's going to be a big contribution from, social justice interest. And what we mean by that is that we've done a lot of work to the clinical skills guide and curriculum to ensure that we are accommodating for diversity and inclusion. There's going to be many populations or specific groups that, for example, were underrepresented in previous editions or iterations of the clinical skills curriculum, and as such, we've made some pretty significant changes to that. So, Jason Profetto. So I am Dr. Jason Profetto. I'm the chair of clinical skills. Perhaps I should have introduced myself before, and I'm going to be the one doing this orientation. And then there's also a link if you ever want to provide feedback. And Dr. Jeffrey McCarthy is the individual that does all the editing and authoring for the actual guide. All right. Now, here's MF3. Now, there's a couple of things I want to show you. So, MF3, there's going to be two things. This is the actual clinical skills. This is the content, right? So this content is in chapters based on the actual thing that you're going to be teaching or learning. So the abdominal exam, for example, actually has its own chapter, and it shows you like which weeks in MF3 it's going to be used. The diabetic exam has its own chapter. The adrenal examination has its own chapter, etc. But week to week, so you'll see, we said 3 months, right? So there's 12 weeks. What you do each and every week is the weekly session guide. So in week 1, you're going to introduce the abdominal exam, which uses chapter 13. And then from there, there's going to be some practice cases on abdominal examination, GI-related medicine, etc. You'll see that in clinical skills, although we said GI, endocrine, and obstetrics and gynecology, you'll see that there's a few weeks where we spend time on the abdominal exam and history. Then there's some newborn and adolescent stuff that was not included in previous years, and this is one of the enhancements and improvements to the clinical skills curriculum. Then we get into endocrine, diabetic, thyroid, adrenal, and then we make sure that there's a dedicated time for gynecological, sexual history, and obstetrical stuff. I'm going to explain how all of this is going to work. And then the other thing that was, significantly underrepresented in pre-clerkship was dermatology. So dermatology is going to be the 12th and final week, right? So again, this is the stuff that's going to be taught. This is the organization of week to week. And the other thing is, when we're talking about social justice interest, is that there's going to be a bunch of professional competency moments that integrate into specific weeks this concept of diversity, equity, inclusion. So when we start talking about the newborn exam, for example, we're going to talk a little bit about failure to thrive and how the effects of food and housing security or insecurity can actually impact families and caregivers, parents, when this is an issue. Also, when we're talking about adolescent history, the whole concern around child maltreatment, we have also included some content on immigrant and refugee populations. In the gynecological sexual history, IPV is a very, very important topic. We talk about it in professional competencies, and then we're going to be integrating and bringing it into clinical skills. LGBTQ, in terms of being more diverse and inclusive in how we do the sexual history, for example, is going to be a topic as well. And then people of color. So the dermatological exam really needs to be adapted for a variety of different skin tones and colors to ensure that we are as inclusive and safe when we're doing these examinations. So just to give you a sense of the type of connections, you see the breadth of these connections and what they're being used for. These are very, very important, but we ask you to stick to the schedules, include the pro-comp connections when appropriate, and I'll show you a little bit more about that, right? So I'm just going to go. Actually, what I'm going to do is I'm going to just scroll down, because this is the other big thing. So this is a cohort, the class of 2023 entered medical school entirely virtually last August in 2020. This is unique for this class because the whole pandemic and COVID situation. So MFs1 and MFs2 have actually been done virtually. So there are things that were not, so clinical skills was still done, it was delivered virtually, but there were things that we were not able to effectively teach. And what we did was we banked all of these things, and now because we're going to be coming back in person for most of MF3, for clinical skills specifically, there's some in-person practice that we're going to be bringing from MF1 and MF2 into MF3. So the sessions will be as follows. The first week, which technically starts January 4th, is going to be a virtual session because of some of the stipulations with the actual lockdown and when we can come back in person. It's going to be an introduction and overview of the abdominal exam. So you're going to teach it virtually. Week 2 is going to be an in-person session where they actually have the abdominal exam and they can practice. So they're going to have a standardized patient and they're going to practice. And we're going to have some MF1 content that students are also going to be practicing, and that's namely the vital signs and respiratory exam. So you will have standardized patients for this entire week. Now, the good thing is what helps here is that the groups you're going to have are going to be small. So I said before that the groups in clinical skills are the tutorial groups, which are going to be 6 to 7 students. But for these in-person sessions, that's not going to happen. They're only going to be 3 or 4 students, which is very small. But as a result, your ability to do the examination and to practice is going to be, there's going to be ample time. There's going to be a lot of time. And for sure, it's going to be adequate. So being able to do the abdominal exam, like actually practicing it and then practicing some of the vital signs and respiratory exam is all doable in the time that you have allotted. Remember, the MF1 catch-up stuff, this is stuff that the students have already done, but they haven't had an opportunity to practice it in person. In-person session for number 3, the abdominal exam, it's going to be some more practice with like some history stuff, and we're going to do the cardiac and peripheral vascular exam practice. 4 is going to be the abdominal exam. We're going to be looking at jaundice and liver disease. 5 is going to be the newborn history, which is going to be failure to thrive, and there's a pro-comp connection. And there's also going to be renal and volume status exams, which the students are going to have a chance to practice. And then, I mean, as you go here, you'll see it's all the same sort of thing all the way down to weeks 10 and 11. Now, what's happening in weeks 10 and 11 is that there's going to be 2 sessions. And some groups might have, in week 10, it might be the virtual session, which is B, or in week 10, it might be A, the in-person session, and then it just flips for the next week. So half of the groups are going to be doing the in-person gynecology and obstetrical exams with models, and this is going to be specifically done with the obstetrics department. And week B, when the clinical skills preceptors are now involved again, we're going to be practicing the gynecological and sexual history. And this is where we have the very important pro-comp connections. They're all important, but where we talk about LGBTQ, we talk about IPV, and as it pertains to the sexual history. The sexual history, just to make a quick point, is one of those histories where as opposed to something like a cardiac exam where you're asking about chest pain, there's a lot of sensitive information to ask in a sexual history, a gynecological history. As such, it really does help make the discussion about teaching it and practicing it a bit more fruitful, because there's going to be a lot of different pearls that you can apply and different recommendations based on experience, research, different associations and populations that have made recommendations, how you ask someone if they're sexually active and what does sexually active mean, how you ask about someone's, if someone has an intimate partner, but doing it in such a way that you're as inclusive as possible and not to profile or stereotype unknowingly. And then week 12, the clinical skills preceptors will not be teaching. There's going to be an active learning large group session that's going to have a focus on dermatology, and I'm going to be actually delivering this. So the clinical skills preceptors are going to be responsible for weeks 1 to 11, but in this section here with week 10 and 11, one of those weeks you actually won't be doing anything. They will have in-person practice with the gynecological and obstetrical models, and week 12 you won't be doing everything. So this is, you see here, like we're going to be working in smaller groups of 3 to 4 students. It shows you, like, week 1 is going to be virtual, week 12 is going to be the active learning large group sessions, the sensitive exam, how there's going to be the in-person and the virtual. So all of these things are actually here, right? I want to ensure that everyone, however, is familiar with a couple of basics, right? So you're going to have your group of 3 to 4 students. You and another preceptor will be actually splitting a tutorial group, and you'll be responsible for the students that are assigned to you. Things will be scheduled, and you'll be working with the administration to make sure that things are scheduled. You will be actually assigned standardized patients that are going to have stories and information and profiles ready to be able to teach these examinations and to practice on them. You will be responsible for submitting a mid-unit and final unit evaluation, and there will be more information on how to do that. But every single week, it is critically important that you advise students about their performance. So try to observe, try to give feedback, try to give little timbits, try to make sure you have your eyes on students practicing each and every week, so that when evaluations come, nothing is a surprise and people are getting the necessary feedback that they need. We are going to be doing clinical skills for the first time in person during a pandemic, which means students will be required to wear masks, they'll be required to wear face shields, and of course, every time we come to the CSBL or we come to do in-person clinical skills, it is very, very important that we are following the screening protocols for COVID. At any point, if anyone screens positive and that they might have a high-risk contact, they have a test pending, etc., they are excused and they will not be attending for that week. There was a lot of stuff that was happening over the last few months in this regard for the class of 2022 with the transition to clerkship in-person clinical skills. So I think it's just really, really important that we follow all of these protocols and just do the best that we can. Let me show you some of these actual weeks. So remember, chapter 13 is the abdominal exam. So you get the hyperlink and it tells you, everything in terms of all the special tests, the different things to look for, history, physical, what to ask for in an actual OSCE, why you're doing certain things. So it's very, very detailed. There's a lot of very good information. A lot of this stuff that we present here is based off good literature, the AFMC clinical skills working document, etc. And that's the abdominal exam. So you have a sort of a reference that everyone can go to, students, staff, preceptors, etc. Now, if we go back for a second, where's my thumbnails here? So if we go back for a second and we go to the thyroid examination, you'll see it's the exact same thing. So this is the thyroid exam. It's chapter 16. It's got all the stuff that you need. And you'll even see the blue is sort of like the why, like why are you doing things and what you would say. But then there's also the orange, and the orange is sort of for that diversity and inclusion piece that we've been trying to include. I wonder if there's any more here. But then the other really cool thing, which I love, so I mean, it's great to have the diversity aspect, the OSCE aspect, but then there's also some medical decision making and statistics, right? Like likelihood ratios. So when you're discussing different things that you're looking at, you can tell what is like really high yield and what's low yield and what will change your decision making, etc. So when we go back, if you go to the actual weekly session guides, so Medical Foundation Clinical Skills weekly sessions, you'll see that there's a global objective. You'll see that there's an actual setting, so like this is going to be virtual, and then the agenda in terms of what you have to do. These direct observation of clinical skills, these are in the appendix, and you'll see that for the abdominal exam, it shows students what they need to actually do. This is great for practice, for observation, but also for OSCE preparation. And then if you go back, you'll see, so we'll have like the MF1 catch up in terms of what needs to be done. We'll have the standardized case that you do for that actual week. We have some JAMA article things, so this is just, incorporating a 15-minute discussion in terms of, does this patient have acute appendicitis into the actual abdominal exam? So it's all very integrative, right? The actual exam, the JAMA article, the professional competency connections. So you'll see some down here, for example. And they have a bit of a briefing so people can read and you're up to date with some of the questions that can be asked, and there's some references too. We strongly encourage you to follow the actual agendas for each and every week, to be as thorough as you can in ensuring that you do all of them, but also try to be as organized as you can with your time. So it takes a bit of planning, but at least a lot of the skeleton is here for you to follow. And then I just want to see. So yeah, so these are all this is just an organization with the hyperlinks in terms of the actual content in weeks. So it's gonna be interesting because there's some things that we're doing a little bit differently now. This is clinical skills. It's definitely going to be in person. There's going to be the virtual session in week 1. There's going to be the virtual session in week 12. There's going to be that virtual session in week 10 or 11, while the other week is going to be an in-person practice with the gynae department. We're including some MF1 stuff. It's busy. This is going to be a busy MF, but it's really good. And clinical skills is one of those things that students love. They really appreciate it. The preceptors are always role models. So, right from the beginning, get a good sense of what the group is like, what their expectations are. Use the concepts of small group and self-directed learning to help guide you as best as possible. And ultimately, when you do this teaching, have fun and ask for feedback, ask questions, make sure that you're observing. And if you ever need any help or you have any questions, don't hesitate to ask me or to give me a call, and I would be more than happy to chat. And I think because there's a lot of information here, I'll probably keep this brief. I'll end it now, but I look forward to seeing all of you in January, February, and March. And again, thank you very much for all of your commitment to teaching.